Hey everyone, my name's Carmen and I'll be discussing the case study. So, patient profile. YK is a 13-year-old Caucasian male who presented to ED for shortness of breath and wheezing for 4 days. He also reports lack of energy and weight loss of more than 10 pounds. Past medical history. Him and his mom just report a chronically productive cough that's been happening for more than 5 years. Upon initial examination, YK appeared to be underweight and younger than the stated age. His weight is 78 pounds, height of 4 feet 1 inch. So vital signs, blood pressure of 120/80, heart rate 118, respirations 14, temperature 37.8. Oxygen stat was 85% on room air, so patient was immediately placed on oxygen therapy. YK had a cough which produced a viscous green sputum. His abdomen was distended and YK complained of lower abdominal pain. Steatorrhea, which are large, oily, frequent bowel movements, and finger clubbing were also noted. Diagnostic studies. So they ordered a chest x-ray, which revealed evidence of mucus plugging. They then ordered a sweat chloride test performed with the pilocarpine iontophoresis method. Was ordered and it revealed a high chloride level of 83 millimoles per liter. Genetic testing was ordered as well, and it confirmed cystic fibrosis. So the sweat chloride test is considered the gold standard for diagnosing cystic fibrosis. Pilocarpine is placed on the skin and it stimulates sweat production. The sweat is then collected on filter paper or gauze, and it's analyzed for sweat concentration. So anything above 60 millimoles per liter is considered positive for cystic fibrosis. YK had a result of 83 millimoles per liter. Genetic testing is used if the results from the sweat chloride test are unclear. A blood sample or a buccal smear are sent to a special lab that's able to screen for mutations, for all mutations that cause cystic fibrosis. Education. So airway clearance techniques are extremely important because it teaches them to prevent obstruction. As we're aware, normal ciliary motion in cystic fibrosis, airways are impaired. Also, infection prevention, antibiotic use. About 95% of these patients die of complications from lung infections, and antibiotics are the usual treatment, especially for exacerbations. So they must be taught when to take the medication, how, not to stop if they're feeling better. Oxygen therapies, most of these patients will require oxygen therapy at home. Dietary education, so these patients will require pancreatic enzyme replacement of lipase, protease, and amylase at home. It's important to educate them on when to take them, which is usually before each meal and with a snack. They should also be encouraged adequate intake of fat, calories, protein, and fat-soluble vitamins like vitamin A, D, E, and K. Also in summer or when patients sweat a lot, they should be taught to add dietary salt intake to their diet as well. Insulin treatment. A lot of these patients may require insulin because the islet cells in the pancreas are destroyed, so it's unable to fully respond to carb intake. So diabetic teaching should be performed as well. Community resources such as the Cystic Fibrosis Foundation. These care centers offer the best care, treatment, and support for patients suffering from cystic fibrosis. It's also a place where people living with this illness and their families can meet. Also, a multidisciplinary team should be involved since cystic fibrosis requires long-term medical treatment. A team of nurses, doctors, physical therapists, respiratory therapists, dietitians, social workers should all be involved and included as part of the care team, as well as the patient and the family.